Hello, my name is Andreas Budi, and today is August 26, 2020, and this is my video for Case Connection 4. So I did case 1, and in this case, the best diagnostic test is to measure the urinary acids level. The reason for this is because in urea cycle disorder, all of the intermediates of the urea cycle will be secreted, such as uric acid, citrulline, and arginine levels. Moreover, disorders in beta oxidation would show elevated levels of ketone bodies, such as 3-hydroxybutyrate in the urine. Therefore, urinary acids is the best test to distinguish between urea cycle disorder and beta oxidation disorder. Now, blood glucose is not the best test. This is because neither beta oxidation nor urea cycle have any impact on the blood glucose level. Serum fatty acid is also not the answer. Disorders in beta oxidation would show how elevated levels in serum acids. However, urea cycle disorder would not show any abnormality in the serum fatty acids level. Now, plasma glutamine is often used to detect urea cycle disorder. However, it does not distinguish urea cycle disorder from beta oxidation disorder. After a full blood workup, the patient was found to have elevated ammonia level, elevated uric acid level, but normal plasma citrulline level. And based on this information, the most likely enzyme to be affected is ornithine carbamoyl transferase. The reason for this is because if ornithine carbamoyl transferase is deficient, the immediate substrate to be affected and elevated in carbamoyl is elevated in carbamoyl phosphate. When carbamoyl phosphate is elevated, then the uric acid level is elevated. Consequently, the carbamoyl oscillator is being shunted to pyrimidine synthesis, which uses uric acid as an intermediate. Ammonia level is also elevated. Since carbamoyl phosphate is shunted, then there is an elevated level of ammonia. Citrulline level is normal because the enzyme immediate to it, arginiosuccinate synthetase, is not deficient. On the other hand, arginiosuccinate lyase is the least likely to be impaired because it is far removed from the substrates mentioned. And then I did case 3. So the best explanation for the presentation of gout in this individual is decreased urinary excretion of uric acid. The reason for this is because there's an elevated level of uric acid in the blood, as shown by a higher than normal plasma urea level. However, urinary uric acid level was shown to be normal. Therefore, the best explanation for gout for this particular patient is decreased urinary excretion of uric acid. Overproduction of purines is not the best explanation. When purines production is increased, then we'll see elevated levels of plasma urate along with urinary uric acid. Decreased level salvage of purines is also not the best explanation. In this case, we will see normal levels of plasma urate and urinary uric acid. Now, high fructose diet increases levels of salvage purines when fructose is broken down, and consequently, when fructose is broken down and there's a high level of salvage purines, uric acid is released.